Hello everyone. So today we'll be discussing in short about air pollution and in general environmental pollution and its effect on female fertility. So a lot of patients come to us with a very low AMH or fertility problems, and they have this question that what did we do to make our fertility journey so difficult, and why is it so difficult for us to conceive nowadays? So we have to understand a lot of things are outside the human control, so to speak. Genetics do play an important role in reduction of AMH, but at the same time environmental pollution and especially air pollution also does play a lot of important part in the female fertility journey. Because air pollutants and in general environmental pollutants such as plastics, preservatives, and all of the things, pesticides and fertilizers that we end up consuming on a day-to-day basis invariably through our food and through the air, that does affect the hormonal balance of a female, and in turn it can affect the menstrual cycle and fertility issues can arise. So what can we do to reduce the impact of pollutants and environmental pollutants? So the most important thing is to reduce the consumption of plastics, because anything that is consumed out of a plastic is generally going to have microplastics in them. For example, milk, bread, any kind of processed food like biscuits and chips and Maggie. All of these things are going to contain some amount of microplastics that we end up consuming from, at a very young age. So these things do contribute to our fertility journey and to our overall hormonal balance. Whether it is trying to get pregnant, whether it is the pregnancy journey, whether it is perimenopause or menopause, it certainly affects all the aspects of a female reproductive journey. So it is very important for us to remember and recognize the problem, and to reduce the consumption of microplastics on a day to day basis. As far as air pollution is concerned, pollutants can cause a disruption of hormonal health. We can't really do much about it. The only thing that we can do is to have air purifiers, if at all possible, in your work environment and at home, and always to wear a mask when you are traveling outside, especially when you know that you are going to be traveling in a very polluted area. There is one last thing that I would like to stress, that if you are somebody who is trying to become pregnant or who is trying to delay their pregnancy, please get a health checkup done from a gynecologist as soon as possible, so as to know where do you stand exactly in the fertility journey. Because if the condition of your hormones or if your balance of hormones is really not there, then you do require some kind of treatment, for conception, as well as for you to make a decision so as to how much to delay the pregnancy journey. So it is very important to evaluate yourself at the right time rather than regret it at a later stage. Thank you.